Guys, welcome back, and today we are going to discuss about other nursing care plan on ineffective airway clearance. We will see the nursing diagnosis first. So I have given a list of nursing diagnoses here. You can choose depending upon the condition of your patient. So let's see the nursing diagnosis first. Ineffective airway clearance related to excessive mucus production secondary to respiratory infection, or ineffective airway clearance related to bronchospasm related to asthma, or COPD, that is chronic obstructive pulmonary disorder. Then ineffective airway clearance related to airway obstruction due to foreign body or tumor. Or imagine your patient is having cough reflex or related to stroke, or stroke is the condition, means you can write ineffective airway clearance related to impaired cough reflex secondary to stroke or neuromuscular disorders. For example, your patient is having decreased energy level and fatigue is the reason, means ineffective airway clearance related to fatigue and decreased energy levels. Or ineffective airway clearance related to sedation or altered level of consciousness. So there is a list. You can choose anyone depend upon the condition of your patient. So first section of nursing diagnosis we have done. Now we will go to second session. In second session, you have to start with as evidenced by, right? So as evidenced by ineffective or weak cough, or as evidenced by dyspnea or abnormal lung sounds, or retained secretions, or tachypnea or bradypnea, or decreased oxygen saturation, or use of accessory muscles for breathing, or cyanosis. So evidence is compulsory in Nanda nursing diagnosis, right? So you have to write the condition, you have to write the etiology, you have to write the signs and symptoms. So related to something, as evidenced by something. So there is a list of evidence is also here. You can choose depend upon the condition of the patient, and I have given an example here. So this is a example nursing diagnosis: ineffective airway clearance related to excessive mucus production and impaired cough reflex, as evidenced by difficulty in breathing and or labored breathing and ineffective cough. So this is the nursing diagnosis. Like that you have to write. And goal, I have given 3 goals here. Depend upon the condition of your patient, you can write the goal also. The patient will demonstrate effective airway clearance as evidenced by clear lung sounds, or the patient will maintain adequate oxygen saturation levels within 24 to 48 hours, or the patient will exhibit, that is nothing but demonstrate, improved breathing patterns with decreased respiratory effort within 24 hours. Okay, so depend upon the condition of the patient, you can write the goals also. Now we will see the nursing care plan. So while writing your nursing care plan, please follow this format: assessment, diagnosis, planning, rational implementation, and evaluation. You have to include all these columns in your nursing care plan. First session is assessment. In assessment, 2 things you have to write: subjective data and objective data. Subjective data means what the patient complains about their condition, and in objective data, you will write what you have observed from the patient's situation. So in subjective data, the patient complains that she or he is having difficulty in breathing and coughing throughout the day. Objective data, that is your observation from the conversation with the patient. That means you have observed cough, normal lung sounds like wheezing or crackles, decreased oxygen saturation. Okay, that you have to write in objective data. Diagnosis, please copy and paste the same nursing diagnosis depend upon the condition of your patient. Then planning. So while planning, the first planning is always history collection and physical examination checking. So first planning, do history collection and physical examination. Rational, start with 2 to understand the general condition of the patient. Implementation in past tense, done history collection and physical examination. Next planning, perform vibration postural drainage type of respiratory therapy techniques 2 to 3 times a day. For what? To open the airways and to thin the mucus. Implementation, perform respiratory therapy techniques. Next planning, elevate the head of the bed to 45 to 90 degrees. For what? To mobilize secretions as well as to make it easier to expel them. So when we elevate the bed, the patient will get actually comfort, and will get a comfort to breathe. Okay, that can mobilize the secretion, and that can also make it easier to expel the secretion out. So in implementation, you can write elevated and observe the patient. Next planning, encourage deep breathing and coughing exercise in every 2 hours. For what? To improve the breathing quality. Encourage to do deep breathing exercise and started to perform it. So that is the next planning. Next, perform chest physiotherapy for what? To mobilize the secretions. Implementation, performed chest physiotherapy. You can mention which physiotherapy is performed or performing, for example, like percussions. Then next, planning, provide adequate hydration. Water is very, very important. For what? To thin the secretions, provided oral fluids and IV fluids. Next, planning, use airway suctioning as necessary. For what? To prevent the accumulation of fluid or to evacuate or to take the fluid out or to clear the airway. Okay. Implementation, performed airway suctioning. Next, planning, administer oxygen therapy to maintain the oxygen saturation. Rational, to reduce the breathing difficulty as well as to maintain the oxygen saturation. Implementation, administered oxygen to the patient. Next, monitor and assess respiratory status every 2 hours. Vigilant, frequent monitoring is compulsory. Okay, for what? To avoid the risk as well as to see the progress of the patient. In implementation, you can write monitored and recorded. What you have monitored, what you have observed, that you have to record. Documentation is very, very strict. Next, administer prescribed medications, for example, like bronchodilators or expectorants. For what? To reduce the complication as well as to reduce the infections if there is any infections. Implementation, administered medications as per the order. So sometimes antibiotics also will give to prevent the infection. Okay. In evaluation, you can write the patient successfully expelled secretions and began breathing without difficulty. That is not that much medical way. So in medical way, we can write the patient effectively expectorated secretions and demonstrated improved respiratory functions without signs of any kind of distress. All right, guys. So this is the nursing care plan for ineffective airway clearance, and I've written here like what vibrations and postural drainage you have to perform. What is vibration? What is postural drainage? So basically, these are respiratory techniques used to help clear mucus from the lungs. Okay, typically for patients with conditions like cystic fibrosis or any kind of infection or inflammation, for example, like chronic bronchitis. What does vibration means? This involves applying manual or mechanical vibration to the chest to help loosen muscles in the airways and making it easier to cough out. The postural drainage means this technique involves positioning the patient in specific ways to use gravity to help drain mucus. The lungs. The person is placed in position where mucus can move towards the throat and be coughed up or suctioned out. So changing the position is nothing but changing the position. Okay, like while elevating from to 45 to 90 degree, automatically the patient will get an easy way to get cough. Then we have to perform minimum 2 to 3 times per day, means the treatments are scheduled multiple times daily to keep the airways clear and improves breathing. Minimum 2 to 3 times you have to perform. That's what in the care plan also I have written like 2 to 3 times a day, okay, to get a better result. All right, guys. So this is about the nursing diagnosis and care plan for ineffective airway clearance. Hope you understand. And next video, we will see another nursing diagnosis and care plan. See you guys. Thank you.